Thank you, Audrey. Well, doctors are swamped dealing with COVID-19, but the work continues diagnosing autism and other developmental differences right here in Central Illinois. Now, 2 months ago, I brought you a Digging Deeper report about how COVID-19 was impacting education for those with autism. Now, I sat down with 2 doctors to find out how they are continuing their work despite the pandemic. University of Illinois College of Medicine Peoria has a team of physicians with expertise in behavioral and neurodevelopmental pediatrics. They work to diagnose children on the autism spectrum and provide ongoing management of their care.
Children with autism spectrum disorders like things to be typically in the same order, and they get upset with changes in routine. So 2020 has been the ultimate change in routine.
But it's not just the children with changes in routine, but the doctors too. They say adaptation has been key at UI Comp because with autism, early intervention is crucial.
Majority of the children, when they are born with excessive neurons, and you make sort of functional tracks when you are going through the experiences of life. So if you're not catching the child when they're delayed and they need a little help to go that route, then you're going to miss those children.
But it's not just about proper diagnosis for access to therapy.
Oftentimes we see autism with ADHD or attention deficit disorder. Oftentimes we see it coexisting with anxiety. And that's part of the reason it's extremely important for children to be evaluated by a medical provider.
While COVID-19 has added many challenges to their process, they hope there's a silver lining.
You know, we've been pushed to see what can we do remotely and how can we do this differently and what are the various options with, children with different types of needs for diagnosis.
And they say they will continue the hard work because with the proper tools, any child can succeed.
And that is the misconception, that a number of people would just write them off, that they are not capable of having a purposeful, positive, and fruitful life. If we catch them early and work with them, then they can have a very productive life.